So good afternoon, everyone. I'm Debbie Hart, and I have the honor of serving as the president and CEO of BioNJ, the voice of the life sciences industry in New Jersey. And I'd like to thank you so much for joining us for From Pandemic to Endemic and Where We Go From Here and When. An evolving question that is top of many of our minds. In fact, such an evolving question that we actually changed the title twice as the virus evolved while we were in the planning stages and promoting stages, even after we announced. So the first version proclaimed that it was finally over. Well, we realized that perhaps it wasn't. We'll hear more about that in just a moment. If nothing else, COVID taught us to be flexible. So here we are. This afternoon's webinar is brought to you by BioNJ's HR Committee, which is co-chaired by Martin Rexroad and Lynn Anderson. And we thank them for all of their tremendous work along with the rest of the committee. So additionally, we would like to thank Lynn's company, Fagery Drinker, and Martin's company, PTC Therapeutics, for sponsoring today's webinar. So we have an action-packed agenda, as you saw. That's why you're here. So we're going to get started right away. We welcome your questions via the Q&A box, and we promise to get to as many of them as we can. We will be on a tight schedule because we do have 4 different segments to this program. So it's my honor to bring back our first speaker. As the foremost expert on the pandemic in New Jersey, I really can't think of a more knowledgeable leader to give us an update on the virus, the variants, and the vaccine. In addition to being an epidemiologist and internal medicine physician, he is the chancellor of Rutgers Biomedical and Health Sciences, as well as the executive vice president for health affairs at Rutgers, the State University of New Jersey. He's been with us for each and every one of these sessions since the pandemic began, and there have been many of them. So a big thank you and a huge welcome back, Dr. Brian Strom. Over to you, Dr. Strom.
Thank you, Debbie. Can I get the first slide? What is, as a reminder, what is SARS-CoV-2 and COVID-19? SARS-CoV-2 is a coronavirus. There have been multiple genetic variants, and it causes a severe acute respiratory syndrome. December 31st, 2019, in Wuhan, 4 cases of a pneumonia-like disease were reported to the China office of WHO. The disease was declared by WHO epidemic in February 2020 and declared pandemic in March 11th, 2020, and which is where it stands now. Vaccination is the most effective strategy for prevention and control outside of public health interventions, and we'll talk more about that. Next slide, please. What treatments and preventions are now available? We're more than 2 years into this pandemic. In order to prevent or treat this disease, and again, COVID-19 is the disease, SARS-CoV-2 is the virus, there are currently 857 unique active compounds in development. 3 of them have been approved, including vaccines and remdesivir as an antiviral. There are 9 in EUA status, emergency use authorization status, including other oral agents and non-oral agents, either oral agents or parenteral agents, as the case may be. Next slide, please. Of note, currently is the BA.2 variant, sometimes known as stealth Omicron. Cases and hospitalizations had been rising in the EU. They're now beginning to come down again. Per Tony Fauci, this is a result of a combination of the spread of this more transmissible stealth Omicron, that is, BA.2 variant is more transmissible than Omicron was. It's also spreading, and the cases and hospitalizations are increasing because of the opening of society and the loosening of public health precautions, and also from waning immunity from vaccinations or from prior infections, as the case may be. The Omicron, referred to as subvariant BA.2, it's Omicron, but a variant on Omicron, is also now spreading rapidly in the United States, now comprising 35% of the variants circulating. BA.2 is on track to become the dominant variant in the very near future in the US. It's too early to tell if BA.2 manifests detectably different symptoms than Omicron. Next slide, please. To give you a sense of where things stand across the world, I'm happy to say the US is now yellow, where a lot of the rest of the world is orange, and Europe is now red. Next slide, please. If you look across the US, much of the country is now yellow. The Nothing's green. Nothing's on track to contain the disease. But there are states like the Mid-Atlantic states that are orange, so that they're now beginning to increase at risk of outbreak. Next slide, please. If you look at the average positive test rate, WHO is most comfortable when this is less than 5%. What that means, all tests done, less than 5% are positive. This means that you're probably not missing a lot of cases. We, of course, the US are below 5%, but as you can see, it's a little bit picking up on now. Next slide, please. If you look at the 7-day positivity rate, total and positive test, again, you can see, again, it's beginning to pick up. And that's recognizing, of course, that we're now missing a lot of tests because of home tests being done. Next slide. You look at the case fatality rate early in the pandemic, the case fatality rate was much higher. We are now equilibrating. If you look in the sort of June 21 timeframe, it was equilibrating at about 2%. Then Omicron came out and it dropped some. Omicron seems to be more milder, and both in the US and in the world, we're equilibrating a little bit above 1%. So of everybody who gets sick from this disease, who gets confirmed infected with the disease, a little bit over 1% die. So this still is a substantial number of deaths occurring. Next slide, please. If you look at the percentage of the US population vaccinated, this only goes back through the last 2 months. You can see a little bit over 60% are fully vaccinated, and we're approaching 80% to be vaccinated with at least one dose. Next slide, please. If you look at where we stand in New Jersey, again, this is COVID risk levels. In April 21, a number of counties were red and other counties were orange. Next slide, please. If you look in April 22, you can see we're doing much better. There are some counties in the northern part, again, this has come back as more of a mid-Atlantic disease, the way it started. The northern counties are orange, the southern counties are still yellow, and in terms of being slower. Next slide, please. If you look at daily COVID cases, you can see the original spike, subsequent surges, the most recent Omicron surge, and dramatically dropped from that. These data are a little bit misleading because, again, a lot of cases, there's a lot more testing done now. So there's a lot more cases that were picked up with Omicron than was picked up earlier. And nowadays, a lot of testing is being done at home, and so it doesn't get reported. Next slide, please. If you look at the hospitalization data, which is probably more meaningful, you can see the original massive surge that we went through in New Jersey, and then the subsequent surges that have occurred. Omicron more on the right-hand side in December, January, February of 22. And then you can see how it's come way down. But if you look closely, you can see it's beginning to come up again at the end. The hospitalization data are also a little misleading because these are people who are hospitalized who have positive tests. And now with Omicron, fully, because it's milder, fully half the people who are hospitalized are not hospitalized for COVID, they're hospitalized with COVID. And they were hospitalized for other conditions and when tested, found to have COVID. So again, it's markedly better than it was before, much, much, much better than it was before. But there's this little bit of an uptick you can see now emerging. Next slide, please. You look at the percent vaccinated, you can see a part of why New Jersey is doing better than most of the rest of the country. 75% with some vaccination, almost just about 90% have had 2 doses. Only 35% have been boosted though so far. So that's where we're lagging. So we are doing better in vaccination than most of the country. And with that, we've done much better in terms of the last surges. Next slide, please. You look at the variant data, the proportion of cases that are now BA2 in New Jersey is now 71%. So BA2 is, as expected, taking over in New Jersey. Again, it's about, I don't remember what the number was, 40, 50%, something like that. In the rest of the country, but the Mid-Atlantic, it's surging more, and that goes along with the Mid-Atlantic being orange instead of yellow. Next slide, please. If you look again across the world and locally now, you can see cumulative confirmed cases worldwide are approaching 500 million. Those are confirmed cases. The real cases are undoubtedly 2 to 3 times more than that. Cumulative confirmed cases in the US, 80 million. Again, undoubtedly 2 to 3 times higher than that. In reality, the cumulative US deaths are now approaching 1 million in New Jersey, and there are still substantial numbers of deaths every day in the US from the disease. Way down, much better than it used to be, but substantial numbers still. Cumulative New Jersey confirmed cases are approaching 2 million. Again, that's confirmed. Real cases are much more than that. Confirmed deaths in New Jersey now exceed 30,000. Current New Jersey hospitalizations are 379. Dramatic improvement from at one point, we were certainly in the thousands. At one point, we were up between 5 and 10,000. So much better than it was. Currently on ventilators in New Jersey is only 27, much better than it was. Currently in intensive care units in the state, only 53. Current positivity rate across the state is 3.2%. So within the WHO's recommendations, but the rate of transmission is now 1.09. A rate of transmission of 1 means each case leads to 1 other case. A rate of transmission of less than 1 means the number of cases is shrinking. And we were less than 1 for the last couple of months in New Jersey. Rate of transmission over 1 means the disease is expanding. So again, you're seeing the data indicating we've passed the nadir and we are now beginning to expand again. And we see that. I get data on with Rutgers every day. And for a number of weeks, we had almost no cases. And now we're having 1 or 2 cases a day with that. So we are on the way up in New Jersey. Next slide, please. Rutgers case rates. I won't walk you through this, that you can't read enough. Time has gone on. But as you can see, multiple surges, some related to population surges, some related to kids going on vacation, kids going on summer vacation, a football team coming on board, the spring breaks, and so on. Each time we were able to successfully beat it back with very aggressive contact tracing. It has worked very well. But again, this pattern of continual surges is something we're going to all need to get used to. Next slide, please. Testing update. You can see here at Rutgers in the last week, we had only 4 positive cases. Our positivity rate is 0.53% compared to the state positivity rate of 3%, 3.2%. And as I've said before, throughout this whole pandemic, I'm very proud to say Rutgers has been an island of health in a sea of disease. Fortunately, the sea of disease in New Jersey is doing dramatically better than it has done in the past. Next slide, please. So we've gone through this process now of flattening the curve that people who've seen this before have seen me use this slide before. The real concern is, do we get to so many cases that the healthcare system can't treat all those cases, and you go and exceed the number of cases. We were very close to that in New Jersey during the first surge. Essentially every single day, we were nip and tuck in terms of number of ICU beds, number of beds of ventilators, et cetera, et cetera. We have now passed the Omicron surge, and again, we have not exceeded the healthcare system capacity. But that balance, one of the key, what makes this worse than flu? One is the case fatality rate, which is 20 times higher. And the other is if you're not vaccinated. And the other is the issue of it's a more serious disease. So overwhelming the healthcare system. Next slide, please. Will Omicron create herd immunity? I think we've come as close as we're going to. Herd immunity on the left-hand side, you see what happens without herd immunity. The rate of transmission of this disease exceeds 5. So every case, if there were no protective measures and no vaccination, every case would lead to 5 additional cases. The concept with herd immunity is when you have a case, everyone around them is immune. And so they can't really spread it to other people, except in this example, 1 additional person. What Omicron has done, it is so contagious. We did very well with vaccination. And then in the January Omicron surge, it's so contagious that most people who had not been vaccinated got Omicron. And the hospitals were filled with people with Omicron in the process. And a bunch of people who had been vaccinated got Omicron also. Fortunately, it was milder in general, Omicron, compared to the prior variants, and it's especially milder in people who've been vaccinated before. Next slide, please. A little bit of epidemiology 101, when something is called epidemic, when there's widespread occurrence of a disease in a particular place and time. SARS was an example, MERS, typhus, cholera, other examples of epidemic disease. Pandemic disease are when you have an epidemic disease that becomes widely prevalent across a wide region, continent, or worldwide. One example is the bubonic plague. Another example is the 1918 flu, which we still have. It's in our flu shots that we get every year. And another example was COVID-19 alpha. Once we hit Delta, herd immunity became impossible because when we're dealing with alpha before, vaccination not only protected against serious disease, but it protected against getting infected. So vaccination would protect against the spread of disease. That wasn't the case anymore with Delta, or subsequently. It decreased the risk of getting infected, and so it decreased the risk of spreading disease, but it didn't eliminate the risk of spreading disease. Endemic disease is when a disease is regularly found in a population, examples of malaria, influenza, HIV/AIDS, and I would posit now COVID-19 Omicron. This will be with us for the rest of our lives. We are now in the endemic stage, in that it's always going to be here. We will continue to have surges, though. It doesn't mean only a low level. Flu you have come winter, and whether this will become a winter virus worse or not, there's good theoretical reason to think it might. But unless there's another variant that's going to change everything. There's another variant that escapes our immunity. But Omicron has basically run into what one of my colleagues called a wall of immunity. That basically so many people are immune, either because they got vaccinated or because they got sick. But that immunity wanes over time. Next slide, please. So what does the future hold in stock for us? Multiple considerations. I'm going to show you two different conceptualizations of what living with COVID-19 is going to mean. The realities are it's impossible to eradicate COVID-19 now, as I alluded to. There's an ongoing need to reduce personal and community risk. Therefore, there will always be a level of community risk you need to pay attention to. Level of community risk in New Jersey now is low. This is about as low as it's going to get, because it's on the way back up again, as I alluded to. We have a wide variety of control measures to choose from. We have approaches to make risk-benefit decisions that we've learned from other viruses that circulate. There's a need, though, to accept the reality of a new level of risk in our lives. This is the new reality, with varying circumstances of individual lives. So these become individual decisions of how much risk do you want to take. Do you want to wear a mask or not? Depends on how much risk you want. There also is the issue of the capacity of the health care system locally. Right now in New Jersey, we're fine. And the vaccination status of children. One of the groups that still needs protection is children, because the younger children have not yet been vaccinated. Next slide, please. Another way of, continuing this, this is from the epidemiology monitor. Control measures include vaccinations, include use of well-fitting masks, not cloth masks, well-fitting masks, and testing for the virus at home. Impacted activities include indoor dining, air travel, socializing with elderly people, attending movies, theaters, concerts indoors, visiting other persons in their homes. All of these increase the risk. Are you willing to take that increased risk? Partly depends on background risk, partly depends on your susceptibility, and partly just depends on your risk tolerance in general. Next slide, please. Decisions need to be more individualized, more individual tailoring than earlier in the pandemic when these were public health recommendations. Now they're risk-benefit decisions that'll no longer be one size fits all. Questions, before we had lockdown, school closures, restrictions on mass events and gatherings. I don't think we're going to be there again, fortunately, because the disease is now more endemic. But there's still going to be surges. It's still going to go up and down, mini surges, going to go up and down. How do pandemics end? There's no clear-cut endpoints. They don't really end. It's more a social decision than a biological decision. It's over when we say it's over. When it reaches a level that we're willing to tolerate that risk and not willing to shut down the economy for it, then it's over. We tolerate 20 to 50,000 deaths a year from flu. We don't shut down the country in response to that. What made COVID different was a 20 times higher case fatality rate. That is changed with vaccination. People who are vaccinated do not have that higher risk of hospitalization or death. Next slide, please. Another way of looking at it from one of my colleagues, Marty Blazer, 4 key factors: the virus, humans, interventions, and society. Talking briefly about each. Next slide. Virus, we need to think about reservoirs. Where is it that the virus still exists? That includes populations that aren't getting vaccinated. It also includes animals. This virus is in deer, it's in mink, it's in hamsters. It's been shown to infect other animals. We will never get rid of it. We can catch it from those animals. Question of mutation speed and the direction of evolution accordingly. Is the next variant going to be more contagious? BA2, stealth Omicron was. Is the next variant going to escape our immunity? Stealth Omicron does not. Who knows about the next one? Questions of transmissibility, questions of virulence, what proportion of people end up hospitalized or dying, and questions of immune evasion. Will they evade our existing immunity? Number 2, humans. Next slide, please. Clinical, the issue of the acute illness, but then also the tail of the illness, long COVID and its consequences, and how much you are willing to tolerate that risk. Duration of immunity, how long does it last? The breadth of immunity, how much protection do you have against other variants? Differences for children because they're not yet vaccinated. Even the age ranges that can be vaccinated, there hasn't been enough uptake. And differences in different populations within the country and of course different countries. Next slide. Interventions, testing, questions of accuracy and timing. Our home tests, our antigen tests, rapid tests have gotten better, but they're still not perfect. But the PCR tests take too long to get the answers back, typically. Questions of behavior, social distancing, masking. Do we live with masks for the rest of our lives? My guess is we're going to see for the rest of our lives masks are going to go on and off, depending on background risk of disease and people's tolerance. At Rutgers, we've now lifted the mask mandate, except in classrooms. We still continue it in classrooms where people are sitting cheek by jowl. But beyond that, it's voluntary. Some people will wear masks and some will not. But the rates are low. Rates go back up high again, the masks come back on again. Vaccines, we're still vaccinating with the vaccine from the wild type of the virus, the original type. There are type-specific vaccines being developed, Omicron-specific vaccines being developed, and they will be available very soon. And then there's broad vaccines being developed that should cover any variant. That'll take longer to develop. Treatments, safety and efficacy of them, they significantly increase the tolerability of getting sick if you can be treated when you get sick. And then there's prophylactic treatment for those who can't take or don't get benefit from vaccination. Lastly, society. There are policy implications here. There's questions of the speed of implementation. How quickly do you implement measures as cases come up? The issue of universality of implementation. Do you require masks everywhere or only in certain places? I told you what we're doing at Rutgers. The value of contact tracing, which becomes even more valuable when the numbers of cases drop off. Questions of mandates. Do you mandate masking or do you keep it voluntary, as an example? And then, of course, the complexity of adherence in politics as overlays of all of this. Next slide, please. Finally, the 4th vaccine, the second booster. The FDA has now authorized a 4th COVID-19 shot as a booster shot for adults ages 50 and over. Again, it's authorized, it's not recommended necessarily. It is permissive. And we'll see CDC hearing, I think next week, and the data will be discussed more widely. The evidence is yet not clear whether the second booster provides additional immunity. There's good data on antibodies that it does. The data from non-experimental data, which is primarily from Israel, is less conclusive. With a finite vaccine supply, should the focus be on maximizing initial vaccinations across the whole world, rather than going on to fourth shots? That's an ethical question. And early data from a series of Israeli studies suggest a substantial reduction in mortality from the second booster among those 60 years and older, but only so far with short-term follow-up. The follow-up hasn't been very long. So is this something widely recommended that should be widely recommended? At this point, it's being left as a choice. Next slide, please. Should I get a second booster? Factors to consider: the timing of the first booster. Immunity wanes over time. So how long has it been since you got your first booster? Personal risk factors: are you a healthcare worker that puts you at increased risk of getting the disease? Are you in any way immunocompromised? Put you at increased risk of severe outcome if you get infected? What's your age, where your immunity wanes as you get older? The risk of infection in your area, again, right now in New Jersey, it's low, but it's beginning to head up. And have you recently contracted the disease itself? What about the risks? Recognize the results of additional boosters may be diminishing over time. We don't know. And variant evolution may ultimately evade the vaccine immunity. We just don't know going forward. Next slide, please. So I'd like to conclude, or almost conclude, as I've shown previously this slide, from the New Jersey Turnpike on the left-hand side, thanking our healthcare workers from the bottom of our hearts. We at Rutgers have thousands of healthcare workers who have spent the last 2 years risking the lives of themselves and their family in order to take care of other people in the state. We're extraordinarily grateful. The stress and risks they took are phenomenal. Next slide. Last slide. However, we are back, for Rutgers, now much more than a year after New Jersey's first COVID case. I'm very proud to say we continue to find the best in ourselves and in Rutgers. And I'm extraordinarily proud of how the university came together and how RHS, our health part of the university, came together, both from a treatment point of view, from a prevention point of view, from a research point of view, contributing to the world as well as to the state and local. So thank you.
Thank you, Dr. Strom. You do have lots to be proud of, and you were a thought leader all along the way in that process. So, including in our sessions that we've done so regularly. So, just a couple. We only have time for a couple questions. So booster, it sounds like you're recommending them for someone who's sort of on the fence, and even after someone's had COVID, and their first booster.
So, COVID works like a booster. It works like having a shot. Over the course of a few months, your immunity then wanes, or at least your antibody immunity. You have a second immune system, which is cellular immunity. And that's much harder to measure, which is why you want to look at what the impacts are clinically as well. And the early data from Israel suggests it makes sense, but it's early and in high-risk populations. I can tell you, I have taken a second booster, a 4th shot, as has my wife. And we initially weren't going to do it because the data aren't yet convincing. And then somebody asked me, why not? And I had trouble answering that question. And so we went ahead and did it. But it is far from absolute, and it is far from clear that this is necessarily the best approach.
Okay. All right. Well, thank you for that. Just one more question. So do you think the FDA will authorize boosters for those under 50? And then will, children at some point be able to be vaccinated, the smallest of the small?
Yeah, I think the answer to both of them is yes. And I think CDC next week will probably recommend boosters as well. Again, permissively, not as a recommendation. Sort of recommending if you want to, if you're high risk, if you have children at home, if you have somebody high risk at home who's older or immunosuppressed or otherwise. I think boosters, second boosters, 4 shots at this point are really individual decisions, like a lot of the rest is individual decisions. The data aren't compelling enough to make them mandatory. And in fact, at Rutgers, we are offering them at our vaccination sites. But though we have required vaccinations all along, we are not requiring the second booster, at least not now. Will children have vaccines available? Yeah, I think they will. It's a matter of finding the right dose that worked. The initial doses that were tested were probably too low.
Okay, very good. And we are leaving a couple of questions on the table. And Dr. Strawn, maybe we'll circle back with you on them. And if we could perhaps get the answers to these folks, that would be incredibly helpful. If you have a moment or two to share your additional wisdom.
Yes.
So thank you, Dr. Strom. You've just been an extraordinary partner through all of this. We adore you, as I hope you know. We hope we never have to do this again, though, but we'll see. But meanwhile, I just wanted to mention to everyone, Dr. Strom will be honored with for this, what he's done here, as well as many other things that he's done that some of which we just heard about. Well, he will be honored with the Heart of BioNJ Award at our annual meeting on June 9th. The intention is to be in person. So if you haven't met the gentleman in person and you would like to, chances are you'll be able to do that there. So Dr. Strom, thank you again, and please take care.
My pleasure. Take care. Good luck. Stay healthy, everybody.
Yes, indeed. Thank you. Okay, so now it's my pleasure to introduce our next presenter to give us an update on the legal landscape once again. So we're welcoming her back by popular demand. She's been with us. She's got that 100% attendance club record, along with Dr. Strong, partner at Vagary Drinker, and also co-chair of the HR committee, Lynn Anderson. Thank you so much, Lynn, for being here, and take it away.
Thanks, Debbie. Thanks for having me, and hello, everybody. So yes, with BA2, it does feel a little bit like Groundhog Day. I have had some clients that have brought everyone back to work at least 1 or 2 days. And one example held the lunch, brought in lunch for everybody in a group to celebrate the fact that they're all back together. And the next day, somebody calls in and said, both myself and my child are positive. I'm traveling for business this week, and in Texas, where of course there is no COVID. And of course, the folks that I was going to have dinner with last night both tested positive yesterday. So it is a bit of Groundhog Day, but I think that we are back, we're coming back. And so what do we do? Next slide, please. There's some key things that I think we heard from Dr. Strom that we need to incorporate in how we return to work with the virus. The new reality is, and the risk assessment and the individualized assessment are things that resonated with me. The other thing I heard from him is the capacity of the healthcare system. And those are all themes that we're hearing in terms of where the CDC is going, where OSHA is going, and probably where the courts are going to go. What do you have as options for employers? I think what this aligns with is what Dr. Strom talked about in terms of interventions, right? There's still things that you're going to want to do as employers for risk management. And what can you do to contain the spread while you're still having people either come back to work or go out and travel, salespeople, whatever it may be. One of the things is mask wearing is going to continue to be with us, and I'll talk a little bit more about specifically what's happening legally with mask wearing. But I do think that to abandon masks as a culture is probably not going to be well served. I get that everyone's tired of masks, they don't want to wear masks, but I think it is going to be a containment measure that you're going to need probably on an ongoing basis, short and long term. Vaccines, I get a lot of questions in terms of, can I still mandate the vaccine if I'm going to have people on site or if I'm going to have people traveling? In New Jersey, you are still allowed to require people to be vaccinated as a condition of employment, especially if they're going to be coming on site. Not true in a few other states, and you still have to allow for accommodations, both religious and medical. But that still is something you're allowed to do. Now, the question that we're really going to be facing is the issue of the boosters, right? Because there's the fully vaccinated concept, which is you had your initial 2 vaccines, Pfizer or Moderna, or your 1 J&J, but now we're in the boosters in terms of up to date. And what do you do there? And that's something that was teed up by Dr. Strom. We now have people that are eligible for the 4th booster, And we're writing a lot of policies that require not only the fully vaccinated status, but also that you're up to date on your vaccine. So that's something you're going to have to think about because, again, the key is containment and risk management. I will say that New Jersey does have a limited requirement now for boosters. If you are in certain healthcare fields like hospitals, other things, where you have congregate settings, that's part of the effort to make sure that the healthcare fields are going to be able to handle containment of COVID. So if you are in something specific where you're in direct patient care, then you need to be aware of that. The CMS rule, as you may be aware, is still in place. It's being expanded a little bit beyond that, but April 11th, anyone who's eligible for a booster has 3 weeks to get the booster. May 11th, beyond those that are covered by the CMS rule, other healthcare providers do have to get the booster within 3 weeks of April 11th or provide proof of it. So I have a link to that requirement if you're not aware of it and how they define who's covered as healthcare providers within that scope. But it's generally, if you think about ambulatory care, hospitals, congregate type healthcare settings. The other thing is, when we were talking before this started, Martin raised a really good question about contact tracing and do we still need to do contact tracing and what happens in terms of when someone tests positive with the vaccine. The CDC has finally come out with a wonderful tool for quarantine and isolation calculator. It's on their website. Highly recommend that you use that. You basically answer a bunch of questions and it tells you how long you need to isolate. So that's helpful for purposes of working with your employees to the extent they've tested positive, and how you handle how long people should be staying out. Because as I said, this is something we're still going to be dealing with as people come back to work. And also as we're going to be facing, according to Dr. Strom, an uptick in the coming weeks. The last thing I would point out in containment, I think that we're all talking about some kind of hybrid schedule. What do we adopt? Flexible hybrid, whatever it may be. It's still going to be a great tool in managing containment because obviously if people can continue to work remotely as needed, it helps manage spread when you're in the workplace setting. Next slide. So quickly on the updates in terms of some things we covered last time, where we are now, if we go to the next slide. Masks, I think everyone's probably aware the CDC has new guidance. We've now gone to a community level type assessment, low, medium, and high in terms of when you have to wear masks. I think most of New Jersey now is low, although I would point out on March 7th, when New Jersey lifts the mask mandate, they also say on the website that they're encouraging businesses to have individuals continue to wear masks indoors. I know that's very difficult to enforce and is not happening in a lot of workplaces. But I would just continue to use caution when you've got people in close contact in conference rooms or eating situations, that there should be at least an attempt to keep people far apart, 6 feet apart. And you heard Dr. Strom talk about how Rutgers has students continue to wear masks when they're in classrooms. Notably, the CDC still requires folks in healthcare settings, they use the old standard, which was the immunity transmission rate for purposes of having to wear masks in the healthcare setting. So that's still the old standard, not this new standard. And then again, masks should still be available and anyone should be able to wear a mask free from harassment and discrimination because they've chosen to wear a mask, whether or not there's a mandate in place either due to your company or the CDC. Next slide, please. So OSHA, we talked the OSHA ETS, everything we were talking about. The only thing that's really happening now is the healthcare ETS that applies to healthcare workers. In terms of non-healthcare, and I'm talking again more of your hospital type settings, there's really nothing happening. And I'd even point out that they haven't updated their OSHA guidance since the summer. So kind of quiet on that front. It's really going to be what the CDC are doing for most general workplaces. Next slide. The other thing that we talked a lot about was the executive order for federal contractors. It still remains stayed. There's confusion whether certain parts in terms of that executive order are in place, even if the vaccine mandate has stayed. What we've heard is OMB and Department of Defense said we're not going to enforce any of those clauses. Some people are voluntarily contracting that they'll continue to have a vaccine mandate. But again, I think that the general consensus is for right now, that is not going to be enforced and is on hold if you are a federal contractor. Next slide, please. Okay, New York HERO Act, we've talked about that in the past for those of you that have employees in New York. So COVID is no longer designated as disease presenting a serious risk of harm. So you don't have to implement your safety plans, but you still have to have them. You still have to give them to the new employees and prepare to reactivate them. Also, in New York City, the vaccine mandate is still in place for employees. So just a reminder there. So now I want to switch gears, next slide, and I want to go off COVID. Since we are returning to work and we're going to do something new and different in our pandemic updates and talk about a few other topics. Next slide. So New Jersey's WARN Act, it's been on hold. As you may remember, there were a lot of amendments. It was stayed while we went into the pandemic. At some point, the governor will lift the state of emergency. When that happens, this new New Jersey WARN Act will go into effect 90 days thereafter. To the extent that you're doing any kind of restructurings, you just got to keep this in mind. Now 50 impacted employees will trigger this. So it's a much lower standard. Establishment now means anybody in New Jersey. So if you have a couple different locations and you're doing 10 here and 20 there and 20 there, you could trigger it because you need to aggregate. You have to count your part-time employees. You now have to give 90 days notice instead of 60 days notice. And you have to give mandatory severance. And this is different than the severance that you're going to be giving in your separation agreements. So advanced planning is really important when you think about this. The other thing, we're dealing with remote workers. How do we count the remote workers? There's no reference. So if you have employees that are in, Pennsylvania, Nevada, wherever they may be, we're working remotely, they still may have to count. For example, if their home base where they originally were pre-COVID was a New Jersey location, if their supervisors, i.e. where their work is reporting from, is a New Jersey location, or if you're going to say, I primarily am assigning them on some HRIS system to New Jersey, they may need to be counted as New Jersey. And then on the flip side, as you're hiring remote workers, keep in mind where you assign them, and you probably should assign them somewhere, is going to impact how they're going to be counted for the WARN Act. Next slide, please. A couple other things I just want to get on your radar. A big thing that's happening is the issue of pay transparency. And you've probably heard about it in a couple different contexts. We now have in California and Illinois, you have pay data reporting where you now have to report salary and other compensation to the state for your employees, kind of like the EEO2 that we had, the component 2. Also, there is obligations to report salary information when it's asked for at different elements of the recruiting system. or the recruiting process. New York City has a new salary transparency law that requires you to provide both minimum and maximum salary in not only job postings, but in promotion postings. And this is pretty significant. So I know we're talking about New Jersey, folks, but I think taking a look at what they're doing in New York City is important. And it also is going something they've done in Colorado, and it's probably coming to New Jersey. Just the New York City law, real quick, 4 or more employees right now, only one person needs to be in New York City. So you have one person in New York City and 3 people in New Jersey, you may have to comply. The law may be kicked back until November. That's currently being discussed today. But it's something that you want to be thinking about in terms of compliance. What it does is it's not only the people that are applying for the job, but also it's going to be transparent to the people that are currently in those jobs. So what we're recommending is you get ahead of this if you can, to understand and make sure that you've got your salary band set up. You may want to do, we are highly recommending pay equity audits for a lot of reasons. We have a very aggressive equal pay law here in New Jersey. And so you want to kind of make sure everything's aligned before you have to start publicly providing minimum maximum salaries, both in job and or in new hires, as well as lateral and transfer promotion opportunities. So could do a whole session on that, but I just wanted to make sure that everybody kind of has this on their radar. Also, doesn't just apply to W-2s, it applies to 1099 contractors. So the next thing wanted to talk to you about was there's a new federal law that now says that you cannot require arbitration of sexual assault or sexual harassment claims. Now, in New Jersey, you may remember a few years ago, the New Jersey law against discrimination was amended to basically say you can't have any confidentiality agreements if you settle sexual harassment type claims, discrimination claims, retaliation claims. That's been interpreted to mean you can't require arbitration of those claims. We did get a case that said no, there's a federal law, a Federal Arbitration Act that would preempt the New Jersey law, so you can still arbitrate sexual harassment claims. However, as of March 3rd, with this new federal law, it is clear that you can no longer mandate arbitration of sexual harassment and sexual assault claims. So you need to dust off your arbitration agreements or your arbitration programs if you have them. Probably want to talk through what you do from here. Some people are just exempting those claims. Some people are really considering whether I want to have 2 forums, my sexual harassment claim in arbitration, and then my discrimination claims in a lawsuit, and have those proceed at the same time. How do I want to handle this? But I just want to raise your awareness. And then the last thing, I think most of you have this, but we have the New Jersey Secure Choice Program, Savings Program Act. Basically, it says anybody with 25 or more employees has to make sure that they're providing some kind of retirement program, a 401k, a 403, by it's got to be in place by March 28th, I think it was, fully rolled out 9 months thereafter. So with that, I think I will turn it back to Debbie.
Terrific. Thank you so much, Lynn. That was terrific as always. And it's nice to have another topic or two to think about for a change. So let's see. So as people return to work, we do have a couple questions. As people return to work, and we have a couple minutes, so that's even better. As people return to work, are you seeing an uptick of any specific employment claims?
You know, it's interesting. We are, and what we're seeing is complaints of sexual harassment or harassment on the basis of race. People, I don't know if they've forgotten how to interact socially, but people are, it's either events where there's alcohol involved, people are starting to socialize again, or people who, I guess there were issues that they were concerned about before COVID, and now that they're coming back in person, they're raising them. So it's a great time to kind of dust off your training programs, dust off your policies, and kind of remind everybody of how to act appropriately in the workplace. Because I think it's kind of almost like, people have been home alone, not interacting, and now they're out and about and they're getting a little crazy. So the other thing is, this ties into, we have increased awareness with the nation's discussion in terms of racial justice and things like that. And I think people, as well as the Me Too generation, I think people might have let some things slide in the past and now are saying, you know what, let's take a pause. I don't think that was appropriate, and I want to raise my hand and increase awareness in terms of what is or isn't appropriate in the workplace. So that's definitely, we've been very busy with investigations and working through some issues relating to harassment complaints internally, internal complaints and otherwise.
Okay, thank you, Lynn. And so is there a one-size-fits-all policy when it comes to vaccine mandates as we move from pandemic to endemic?
So I would say no. I think it's very important to understand what your employees are doing and where they are working. Obviously, to the extent you have employees that are going to be going into some of these healthcare spaces where the vaccine is required, is mandated, including up-to-date vaccines, I think you want to really focus on what to do with those folks if you have people coming on site. But I think that it may be something where you think about what you're trying to do with your business needs. I think you have to think about where your employees are located, because we have a lot of different states that have some interesting laws in terms of whether you can or cannot mandate the vaccine. So I would kind of take a step back, look at this holistic, what people's jobs are, where they're located, what you're trying to achieve, and then set your policy moving forward. But in New Jersey, I just want to reiterate, you have the ability to require a vaccine mandate.
Okay, very helpful. Thank you. Thank you so much. And again, thank you, Lynn, for being here, for all that you do throughout the year for BioNJ, for the great advice that you are always so ready to give. This is such an important topic. And again, we thank you. Thank you. Thank you.
My pleasure. It's an honor to be part of BioNJ.
Thank you. So as businesses transition back to in-person life, it's really imperative that organizations do so safely for both their employees and their clients. So to that end, we're going to hear about Keeping America Safe, Hackensack Meridian Health's Assist program, which outlines best practices in safety, cleanliness, education, and testing. And I would like to welcome the Director of Client Relations for Hackensack Meridian Health Assist program, as well as the Director of External Occupational Health at Hackensack Meridian Health, Joanne Clark and Kate McDougall, respectively. Joanne and Kate, welcome, and thanks for being here. Over to you.
Thank you. Thank you, Debbie, and thanks so much for having us. Both Kate and I are very excited to be here today. As we are returning to work and evolving from pandemic to endemic, the program that was begun 2 years ago has really evolved, and that's what we'd like to share with you today. We'd like to share a little bit about the work that we're doing with the business and education communities across the state to develop what I'll call a culture of health, not just from an infection prevention perspective, which we've been doing since the beginning of the pandemic, but also from now a more proactive health and wellness perspective, which many of the businesses and school districts are looking forward to as everybody is returning to a more normal existence. Next slide, please. So most of you know something about Hackensack Meridian, but I thought it was important that you see some certain statistics here in terms of the impact they have on the programs that we're bringing across the state to businesses. We are the most comprehensive and integrated healthcare system across the state. And most importantly, there are over 8,000 licensed clinicians that really enable many of the programs and customized programs that we offer to the businesses and school districts in the state and in the tri-state area. In addition, many of the external occupational health and customized programs that we're doing are also being offered to our 35,000 plus team members. So it gives us a really significant level of experience in terms of providing those services that I think is reflective in the way that we bring them programmatically to the state of New Jersey and its businesses and education communities. Next slide, please. So these are just a few of the most recent accolades that Hackensack Meridian has received, but I would say the one that we're most proud of is the one that our CEO, Bob Garrett, was ranked #1 by CEO Forum Group as pertains to his transformation of the healthcare industry across America. And it is his vision that actually is enabling us to offer the consultative services and the customized programs that we are now bringing externally to our clients. Next slide, please. So I'm going to take a minute here and just talk a little bit about how the program began, the Keeping America Safe program, which was its original name when it began 2 years ago. And I will then turn it over to Kate McDougall to talk a little bit about how the program's evolving as we continue as a community to evolve from pandemic to endemic. So 2 years ago, as everybody remembers, a little over 2 years ago, when everything was really at its height of chaos and ambiguity, Hackensack Meridian, obviously, as a healthcare network, was right in the center of it. And as a result, developed a considerable number of policies and procedures and best practices around risk mitigation from an infection prevention perspective. Our executives, our physicians, and licensed clinicians came together and said, how can we better partner with the community in order to provide this information to them so that, you know, it's of benefit to them? Because many of the businesses and school districts were coming to us with questions around many aspects of the pandemic at that time. And so that's what we did. We looked to make this more programmatic and bring it to the community. As a result, the program that was developed, it was consultative in nature and remains consultative in nature. And this piece of the program, the infection prevention piece, continues to exist along with the other services that you'll hear about later in the program. But this piece started out with consultative services and information services, everything ranging from a subject matter expert hotline that allowed people and businesses and schools to call into a hotline or to email us and to have our physician, licensed clinicians, subject matter experts answer questions. Those questions ranged in the beginning of the pandemic from, you know, what are the symptoms, what are the tests, what are the differences between the types of tests, and as things evolved, began to focus on other things as well. Masking, how effective is masking? What are the vaccines, you know, efficacy rates? What are the differences between the vaccines, et cetera, et cetera. All of the things that I'm sure many of you asked along the way. And this really continues to be important as we all return to work. You know, we're really looking at, as Dr. Strom said, moving from pandemic to endemic, but it's more of a social thing. You know, we don't know exactly when this will end, and there are still many more questions. And so that's what our subject matter experts are there for. So it ranges from hotline services all the way to and through reviewing policies and procedures for risk mitigation and having our subject matter experts do site assessments, policy and procedure reviews that ultimately result in a Hackensack Meridian seal of approval, endorsement seal of approval for your policies and procedures. And what we found is that really is the crown jewel of that particular consultation, because it really makes whoever your constituents are, your customers, your employees, your faculty and staff, feel more confident that you are taking the greatest amount of effort and providing the greatest amount of effort in terms of risk mitigation from an infection prevention perspective. Next slide, please. So the subject matter experts that we have focus really on 3 particular areas from an infection prevention perspective. And you'll see later that there are many more areas depending on the customization of the programs as this program has evolved. But from an infection prevention perspective, we focused on clinical, and our subject matter experts really looked at everything from that was clinical about the virus and any kind of questions that were clinical about the virus. The second area of focus was and is in terms of facilities. So we have subject matter experts who do site assessments, who look at the configuration of your office, of your classroom. What is your air filtration system? Do you need an upgrade or augmented air filtration system, automated HEPA filters, things like that, just by way of example. In addition, within the facilities arena, we have subject matter experts on cleaning and disinfecting. So they'll look at the type of cleaning fluids and solutions that are being used throughout the business or school. They'll look at the type of cleaning methods, etc. And we have a checklist, an endorsement checklist that will recommend or require certain criteria be met. And then finally, within the marketing and communications area of focus, our subject matter experts help with things like, how do I communicate what we're doing from a risk mitigation perspective to my employees, to my customers, to my parental community if I'm a school, to my faculty and staff? And how do I create signage that's relevant and pertinent and noticeable in my lobby area, my kitchen area, cafeteria, conference rooms, etc. So those are the primary areas of focus that we looked at, and that's the initial program that started Keeping America Safe and is in existence and continues today. I'm going to now turn it over to Kate McDougall to talk a little bit about what we're seeing in terms of the evolution of pandemic to endemic and how we are evolving the program to go along with that. So Kate?
Thank you, Joanne. So when we look at our current state, we kind of saw what we were looking at through the pandemic and the challenges it created. And we realized that one of the important roles that we need to embody was actively listening. And so we did listen to our business and our community partners. And what we found is there was a need to create strategies and related increased access to testing, vaccinations, and we did, through participation with our partners, do that, utilizing large-scale venues such as stadiums, taking advantage of when the schools were closed, and partnering to vaccinate the community. What we're seeing, and to Dr. Strom's point, is these metrics kind of ebb and flow, and it's really important we continue to monitor those carefully and react to them based on what they're telling us. So we really had to remain vigilant through this. And we saw that as we saw another surge at the end of 21, and we're anticipating increases in the upcoming weeks. So as we transition from pandemic to endemic, we continue to listen. And what our business partners and the educational communities are telling us is that they needed return to work plans, and that had to be prioritized. There was a need to create strong framework for companies to create a plan based on subject matter experts that Joanne talked about in a variety of fields. And as we said, these fields include but are not limited to infection prevention, environmental, communication, and safety. Next slide, please. So what we do is we look at the next normal. And notice I didn't say the new normal because we don't know what the new normal will be. But when we're looking at some of these trends, we really continue to listen and we learn things in healthcare. Some of those things were crisis preparedness, widening of socioeconomic disparities, and how those gaps had to be closed. We look at greater demand for value. We see more of a focus on prevention and public health strategies. We looked at new care delivery models that were beyond what we were currently providing. We had to have a fresh perspective on operations and to reinvent the speed, the turnaround of how we delivered those care. We also looked at digitally enabled healthcare systems. And although many of us had EMRs, electronic medical records, we needed to really move forward even beyond that. In that case, we saw insurance companies also looking at how they were going to transition. So as we continued to listen, we asked ourselves, how did these lessons we learned in healthcare translate into the workplace? And what we saw in the workplace and through conversations with our business partners, we saw a heightened sense and preoccupation with preventing illness, promoting health and wellness, employee health and well-being. Compliance became, a conversation on everybody's agenda, leading to the need for safe practices, standards, risk mitigation. We looked at convenient engagement options, both for the employers and their employees. We looked at accelerated digital transformation and some of the issues that we heard discussed already. We saw them demonstrated through remote and hybrid workplace models. We saw a cultural shift around workplace illness, how employees were really feeling about things, how they were looking at their coworkers, how they were looking at their facilities and the environment. We also saw through this workforce development, upskilling and reskilling. And what we mean by that is we saw a migration of people out of their current industries and looking to go into different industries. Next slide, please. So as we look at healthcare and we looked at what we're considering the future state, in the past, we saw occupational health, we saw health and wellness, and we saw infection and prevention and control. But they were still being viewed in silos. And what we knew we needed to have was these particular areas viewed in concert with each other to create a comprehensive approach to health and wellness. And as I referred to before about value, we looked at different populations and what those values were to the different populations. So as we look at employers and our business partners, they're looking at less sick days, absenteeism, less turnover, improved employee engagement, increased productivity, attract top talent, and lower healthcare costs. Not that these weren't looked at prior to COVID, because they were, but they were really exacerbated by COVID because, as we all know, that it costs less to retain a good employee than to replace and onboard a new one. So as we looked at the business partner perspective, we also had to go a step further and look at what was the employee's value. Certainly they looked at health and well-being when we saw that certain chronic medical conditions put you at greater risk for COVID, and certainly how you responded to COVID and how you got better. The other thing that we looked at, as I said before, looking at disparities in health. We needed to work towards strategies of narrowing those gaps. We're looking at improved access to care. We saw that with telehealth and looking at that digital transformation. Improving care management. We needed to make sure that we were doing the care management in a way that was relevant to the employee base. We're looking at the experience of care, making sure that we're really having people who are satisfied with that care, meeting them where they are. We're looking at improved confidence and safety, which comes from the fact that we're increasing access to care. We're improving care management and those other strategies that we talked about. Next slide. Okay, so as we look at the evolution and understand that we knew that even when we started this, that we would have had to evolve over time. So the different categories that we looked at, we were looking at obviously safety, and there'll be continued a need for infection prevention and control. We're looking at occupational health. Companies and business partners will continue to need those services. But we need to go beyond that. We need to look at wellness. And as we look at that, we include some of those human resource policies and procedures, approach to employee wellness. We've integrated different kind of modalities. Integrative health medicine has become forefront in this. And then we're also looking at how we keep our workforce healthy. Vaccines, as everyone's described here before us, and as we know, they're not going away anytime soon. But we've created disease-specific programs. We also offer telehealth and executive health. And these are ways that we can, as I said, pull them together, view them in concert so that we can create a comprehensive approach. But even as we've given you some examples here, I have to tell you that, you know, this whole evolution really has led us to customizing and tailoring programs specific to our partners. So if I had to sum everything up in a statement, I would say we provide what you need when you need it. And so as a result of that, you can go to the next slide and I'll turn it over back to Debbie. And again, we just want to thank everyone for the opportunity.
Terrific. Joanne and Kate, thank you so much. We appreciate it. I think we have time for one question. We have a question. My company headquarters is based outside of New Jersey, but we have other offices located in the tri-state area. Would you be able to offer these services at our other locations?
Yeah, I'll take that. Yes, the answer is yes, we currently do. We offer the services across the tri-state area, and obviously our brick and mortar locations are in New Jersey, but the consultative services expand beyond.
Terrific. Very helpful. We're leaving a couple questions on the table. We're going to send them over to you if you're open to that.
Absolutely.
Terrific. We will do that as a follow-up. Joanne and Kate, thank you so much very much again, and to Hackensack Meridian for being such a wonderful community partner.
Thank you.
Terrific. Okay, so our next presenters are going to share valuable insights on how to create, affirm, and operationalize a hybrid workforce strategy that supports our employees and our organizational needs. So from CRESA, we would like to welcome Senior Vice President Michael Epstein and Managing Principal, Hybrid Services, Business Technology Sourcing, Jason Jones. So gentlemen, over to you.
Thank you, Debbie, and good afternoon to everybody. My name is Michael Epstein, and I am a Senior Vice President with CRESA Global, Inc. CRESA, along with its partnership with Knight Frank, has over 300 locations worldwide, of which 50 are right here in the US of A. CRESA is the world's largest tenant-only representative for commercial real estate. Segueing briefly on administrative note, tomorrow I will post on BioNJ's LinkedIn page the complete CRESA hybrid workforce solution PowerPoint presentation. Today, however, there will be absolutely no slides, to your sheer and utter dismay, nor will I break into a song and dance routine. I will spare you that. But please stay tuned. We have something that's very timely and important we want to share with you. And stay there. So a little bit more about CRESA. In addition to its tenant representation services, CRESA offers site selection, incentive analysis, lease administration, among a host of other services. Today, we're here to discuss CRESA's hybrid workforce solution. And with that, I'd like to shortly introduce you to Jason Jones. Jason is a managing principal in our Atlanta, Georgia office. This summer, he'll be celebrating his 20th anniversary. And Jason, along with his team, conceived of the need for this service, designed it, and has personally implemented across the United States. Welcome, Jason.
Thank you very much, Michael. It's a pleasure to be here, and I love talking about this topic. It's so timely, it's so interesting, and let's get going.
All right. Well, Jason, many in the audience have not been or have hardly been in their office for nearly 2 years. And as you and I were personally discussing between our own family and friends, there is a widespread difference in how families got comfortable with how they were approaching the challenges of COVID.
Yes.
Right. And without saying there is no right or wrong, it's everyone's individual right, what they got comfortable with.
Yeah.
But with that, Cress's hybrid workforce solution, how does it plan on bringing everybody back who has not been in office for nearly 2 years with such a widespread disparity in, in truly held beliefs?
Yeah, well, it's an interesting question. But I look at it a little bit differently, a slight different take on the question, as opposed to thinking, how do we get everyone back to the office? Which is a common question, natural question, makes perfect sense. So many of us have worked in the office for so many years. That's where work gets done. We've realized, you know what, work gets done elsewhere also, and maybe there's some real advantages to that we can leverage going forward. So instead of asking the question, how do we get everyone back to the office? We recommend a change of mindset and instead say, or ask oneself, how can we take everything that we've learned over the past 2 years and leverage that going forward to create an environment, a working environment or a work model, a flexible work model, where you're going to maximize productivity, maximize the ability to recruit and retain talent, and maximize the financial results, the overall financial results, I would say, of the company. So it's a different view, but I think a appropriate one, and one that will put a company in a more competitive position if they take that view.
All right. Well, thank you for sharing that. Could you walk through, for everybody's benefit, just the overall view, a summary of Cress's hybrid workforce solution?
Sure. Big picture, it's about basically what I just said. How do we leverage what we've learned, put ourselves in a better position for how we work, where we work, when we work, et cetera. And of course, there's a real estate focus to what we do. We're a corporate real estate advisory firm. But one of our mantras throughout has been be sequential to be successful. And by that, we mean there's 3 components of a process to understand or to end in the best position possible for your real estate strategy. And in fact, it doesn't start with real estate. It starts upstream with the human component of the workforce. So you start with what are the needs of our employees, because ultimately that's who accomplishes the mission of the organization. That's your most important asset, unless you have some incredible intellectual property. And then I would say be tied, but your people are paramount. So you start with the needs of the workforce. That leads naturally downstream to the workplace. This is the built environment that supports your workforce. And now it's not just the shared central office, it's also at home or the coffee shop or the hotel or the airport lobby. But what we can control and design is the shared central office. So you start with workforce, that moves naturally down to workplace, and then that leads to your real estate strategy to determine where is that workplace going to be, where are your employees, where are your customers, how much space do you need, and negotiating all the terms that you and the rest of the team are so good at on behalf of the tenant. So be sequential to be successful, I think, is a really important mantra and a mindset for going into the future.
All right, thank you. So where, you talked about the 3 components and workforce being the first one, and how does culture and shared values, work into that component? If you could share with us briefly.
Sure. Well, obviously we believe leadership and culture are the umbrella that overhangs all success. But in order to support those things, you've got to make sure that make sure that all parts of what we call the organizational infrastructure are in place to support your workforce. And there's different components to the organizational infrastructure. By that, we mean the different departments, such as human resources, information technology, the finance department, legal department, operations, et cetera. And all of those have to work together, sort of like a symphony. Everyone's got to be on the same page, and you need a conductor, who's typically the chief executive officer, making sure that the wind instruments, the strings, the percussion, et cetera, all play together in harmony. So when we talk about really the two most important departments for a hybrid work strategy are human resources and information technology. Nothing happens without the technology. Nothing happens without the people. So we like to advise our clients to really focus on their job roles, the people, the training, the mentorship, the cultural change, the shift in how we meet. There's a lot of best practices around hybrid meetings and hybrid work styles that we have developed over the past couple of years. And then we move into the technology, of course, that supports the workforce as well.
Got it. Thank you. And before we move into workplaces, is there one major takeaway from implementing these solutions across the country that you want to share?
Well, to me, it goes back to change your mindset. And well, it's two things. It's change your mindset, moving away from how are we going to get people back to the office, and we're worried about losing people, to instead going on the offensive and saying, no, we're going to learn from this, we're going to take it, and we're going to leverage it to our advantage and leverage it as a competitive differentiator. So I would say change your mindset, and the other critical piece is leadership. This is an opportunity for leaders to step up and really make a difference in the future of their workforce and really accomplishing the vision and mission of their organization.
Got it. And give us a little bit insight into the workplace, that component.
Sure. The workplace is an interesting word because it connotes a physical location, which it absolutely is. But now it's not just one physical location, as so many of us were accustomed to. It's a flexible, convenient, on-demand network of places that I believe an organization will be most successful if they figure out how to mesh these places together. It takes technology to do it, but when you can tie together the shared central office with the home and wherever you may work, anytime, anywhere, any device, that sort of defines, and we call it Workplace 2.0, actually. And even the shared central office that is designed, which is another part of what our company does, as you know, even that has changed significantly and will continue to change as we all adjust to this new way of working. There's going to be more technology in the space. There's going to be what we call a spirit of mobility that's going to be very important to accommodate the freedom to move easily around a shared central working environment, from collaboration area to focus area to what I would call a common area, like an open kitchen, et cetera. So a lot of freedom of movement, change in design, but it all starts with understanding your workforce and what their needs are, how they work most successfully.
All right, thank you. Now with that, before we get into real estate, and I know you're into technology, do you have a favorite new piece of technology that has entered the stream now in light of hybrid and all of that?
Yeah, there's a lot of really neat stuff that's actually already out there and new stuff that's coming and being developed. Things to integrate your calendaring, the way that you work with email, et cetera, into unified communications platforms like the one we're talking on today. And there's a lot of different vendors out there that either integrate with Teams or Microsoft Teams or stand on their own or Google, et cetera. So there's a lot of integrations, but some of the neat stuff, I would say that's really cool. There's a concept called acoustic fencing. So, and I don't mean the sport, I mean like a fence. And what that is, and it's just one example, is now you may have an open collaboration environment, but you've got multiple sitting next to each other. So just imagine sort of a couch system in one area, and next might be a few tables or a conference room table, but there's no walls separating the two. So you would think, well, their conversations are going to get in the way of each other. But there's technology now with cameras and microphones that will only capture the noise or the sound coming from a cone coming out from the microphone. So the person on the other end of the video conference won't hear any of the noise coming from the adjacent collaboration zones. They will only hear, I call it noise, the conversation that's from the cone coming from the microphone. So it's a really neat way to basically create rooms without having to build walls. And that's just one example of many.
Got it. And I know you have a long list.
Yes.
But we're going to hold that off for another time.
All right.
Now we're approaching the third component of the solution, and that is the real estate component.
Yeah.
And as we mentioned at the outset, there are many in the audience that have not been or hardly been in the office for nearly 2 years, and there are a lot of people that are looking at an underutilized asset. And companies have a fiscal responsibility to optimize all assets, whatever they may be. So is there some quick solution? Because if they say, well, I'm only in the space half the time, do I need half the real estate that I have in my office and things of that nature? There's some quick little formula you may have devised over time to help the audience do that analysis.
So it's interesting. I would say if you had asked me that question 2.5 years ago, I would have said, yes, absolutely. And I'd give you a rule of thumb for how many square feet is associated with a single full-time employee. Those simple rules of thumb don't apply right now. There may be some that get developed in the coming years as things sort of settle down, but there's really not. So in the old days, a couple of years ago, it was approximately 200 square feet of office space should be planned for every employee. That 200 square feet is not just that person's desk. That might be 40 square feet or their office, or even less, 120 square feet, a 10 by 12 private office. But they have to occupy hallways. They have to, that's called circulation. They have to use the break room. There's a conference room. There are breakout rooms. There are, just all sorts of the kitchen. There's all sorts of different areas that are shared. So on average, it was about 200 square feet. And that number had been going down over the years as we got denser and denser and denser and more efficient. Now, if you have a workforce that's coming into the office, let's say 50% of the time, there's some very large organizations like Amazon and Microsoft, that's their plan basically is they expect people to be in the office. They say at least 50% of the time. My guess is it's probably going to be about 50%. That doesn't necessarily equate to, well, you only need half the space. It all depends on how much space is dedicated to an employee versus they're going to hot desk or share space or just use common areas and focus rooms. And that planning is not simple. It is, it requires conversations. It requires consensus building among leaders, among team managers, to really understand, and this is something we at Cressa advise our clients, what is the why of your space? Why? Let's start with the baseline. Why do we even have it in the first place? And then when we go there, how are we going to be using it? How does it serve us? And I do believe we're going to see some sort of pound per pound reduction of the amount of space companies need, but it's not going to be a direct correlation because some spaces are probably going to grow. There's probably going to be more focus rooms. There's probably going to be more collaboration areas, although there may be fewer dedicated desks and dedicated offices than there were in the past.
Thank you. So we're running close to the end of our time together today. And Jason, how would you just summarize, if you would, the entire program?
Sure. I think there's probably three things to focus on. And the first would be change your mindset. Look at this differently. This is an opportunity to leverage what you've learned and really take advantage of it going forward in the future to maximize productivity, maximize recruitment and retention of talent, and maximize your financial results. Second, I would say be sequential to be successful. It's through a methodical process of starting with the human component of the workforce, moving naturally to the workplace that supports the workforce, and then your real estate strategy is the way to go. And the last thing is leadership. All major changes are best if increase your chances of success when you have strong leadership that really believes in what they're trying to accomplish and then rolls that vision out to the employees. So focus on leadership of your company.
Thank you very much for sharing all that, Jason. And I want to thank everyone for staying with us throughout Cresta's Hybrid Workforce Solution. Wish everyone a wonderful day. Be well, take care, and goodbye for now. And back to Debbie.
Terrific. Thank you so much, Michael and Jason. So sadly, Jason was not able to be with us this afternoon. So their session was pre-recorded, which you hopefully weren't able to tell, but just wanted to make sure of full disclosure there. Michael is with us. And Michael, we very much appreciate you taking the time. We hope that you found their presentation to be helpful. I'm sure they'll be happy to follow up with you. And we will make sure that Cresta's report is posted at BioNJ's on both BioNJ's social media channels and also added at our BioNJ.org website. Thank you so much to all of today's speakers. Thank you all for joining us. And I hope that you found the entire discussion helpful. And we look forward to seeing you at upcoming BioNJ events. BioPartnering, which starts on May 9th with an in-person reception in Jersey City, and the rest of the week is virtual. And then also annual dinner meeting and innovation celebration, which we talked about a little while ago. Dr. Strom will be honored among many, many others in our ecosystem. I do hope you'll join us. So if you're not a BioNJ member, please reach out to Kim Minton, Director of Member Engagement. And thank you all so much for your time today. Please enjoy the remainder of your afternoon and please stay healthy. Take care. Thank you.